Hey guys, Gil here from Next Level Dietetics. You can find me on my website at www.nextleveldietetics.com. Today's video is going to be about a medication by the name of Clomiphene Citrate, aka Clomid. So first and foremost, I'd like to give some credit for some of the research on this drug and some of the consultation for medical-based information to Dr. George Touliatos, based out of Athens, Greece. Dr. George is a world-renowned expert in the endocrinology of balancing hormones and harm reduction for athletes. He is also a former national bodybuilding champion, as well as a medical practitioner. Therefore, he has the best of both worlds in terms of knowledge and experience. He's the author of this book, Bodybuilding, the Good, the Bad, and the Ugly. It is available on Amazon as well as on his website, gtool.com. I will post a link in the bottom of this video. So now on to Clomid. So Clomid, or Clomiphene Citrate as it is medically known, was a drug, or is a drug, that was essentially introduced as a female fertility drug. Now this drug is part of the closed loop feedback system of the HPTA system. And what it does is it essentially, or in females, it's essentially the ovarian system as opposed to the testes. It stimulates LH and FSH by blocking or binding to the estrogen receptors. And it tricks your body into thinking that you have low estrogen so that it kicks on the production and produces more. In the case of men, it would produce more testosterone, which will then aromatize and convert into estrogen. In the case of women, it will just simply produce more estrogen. And in that case, it would also improve fertility. So it is a fertility drug. The issue that I personally have with this drug, and this is what I wanted to touch on, was that the off-label use, and let me just state that I do not have any issues with off-label uses for medications, because any medication that comes to market has to go through FDA approval for an intended usage. Now, if there is an off-label usage that is later on discovered for that medication, it is a risk-reward ratio. You have to weigh the side effects of that drug along with the reward of that drug and use it on a case-by-case basis under medical supervision, so long as your doctor approves. Often insurance will not cover off-label uses, but you are free to do so on a cash basis with your doctor's permission. So Clomid is one of those drugs that is very often used in two ways. Number one, it is used in the bodybuilding world with or without a prescription, often without. And then it is also used in the medical field to treat type 2 hypogonadism. And that is where your pituitary gland no longer produces enough luteinizing hormone for your testes to produce testosterone. This drug would be effective clinically in raising your testosterone levels so long as your Leydig cells are still effective. So if you suffer from type 1 hypogonadism, this would be a moot point, but often it is utilized for type 2 hypogonadism as an option prior to replacement therapy. Now here's why I dislike this option. And let me just state, I've spoken to hundreds, literally hundreds of men who have gone this route. They've all claimed the side effects that I'm going to go over with you now. Even though their labs showed improvements, the real world results did not translate into that. With that said, I have spoken to a couple of physicians who did indicate some success with some patients. I personally have not seen it myself, but be it as it may. So Clomiphene is what is known as a SERM, S-E-R-M. That is a selective estrogen receptor modulator. What it does is it binds to the estrogen receptors, but it does not activate the receptor. It simply blocks them. Tamoxifen, or also known as Nolvadex, is another SERM. Clomid is commonly used in bodybuilding when guys come off of performance-enhancing drugs and they want to kickstart their own natural production again. So it is used usually in relatively moderate to high doses for a short period of time. The side effects are certainly there, but they do come off of it and usually they recover. That is in healthy men. Those who are suffering from hypogonadism, particularly type 2, the theory behind using Clomid to treat that is that if you block the estrogen receptor, you can stimulate the testes to produce enough testosterone on their own where they would be elevated, and then oftentimes you would titrate that dose down and eventually hopefully come off and see if the HPTA would kickstart and stay. I personally have not seen this work very well practically in anyone in the real world. Yes, the labs will show an increase in testosterone production. Some of the harsh side effects, and I'm going to go into two specific ones. The first one is emotional side effects. So I'm just going to refer to some papers that Dr. George Touliatos had sent over to me. People report anxiety, okay, panic attacks, difficulty with sleep, irritability, mood swings, PMS-like emotional symptoms. Clomid also is notorious for raising SHBG, sex hormone binding globulin. This is a protein in your blood that essentially binds to testosterone and lowers the amount of free testosterone you have circulating. So that generally elevates for Clomid. Estrogen generally elevates for Clomid. Not to say estrogen is necessarily bad, but when it comes up too high and you don't have enough free testosterone, you can get some estrogenic side effects. So the mood swings are terrible. The levels of depression, panic attacks, and whatnot, and I've seen it firsthand. Those are terrible, and those are very, very common with Clomid. The other issue, and this one is basically a game changer. This is a deal breaker, in my opinion, for anyone considering this drug as a monotherapy for type 2 hypogonadism, and that is your vision. So SERMs essentially bind to the estrogen receptors in the back of your eyes, and they block them. Now, we don't know the long-term effects of blocking estrogen receptors. We do know estrogen is very important for heart health, for joint health. It does help promote synovial fluid in your joints. A lot of people report that when they use aromatase inhibitors to lower estrogen, they have very dry joints and a lot of pain. They develop erectile dysfunction. Loss of libido, loss of focus, concentration, all these things are a low estrogen side effect. The problem with having a SERM bound to your estrogen receptor is you're essentially going to experience a lot of these low estrogen side effects. Even if your serum level on your labs shows a normal estrogen, those receptors are bound up by the Clomid and they're not able to effectively utilize the estrogen in your blood. So therefore, it is a pretty nasty drug. People have reported floaters, blurry vision, discoloration of vision. The good news is a lot of that is reversible if the drug is discontinued soon enough. But again, these emotional and visual side effects, in my mind, are not worth the hassles of going 6, 8, 12 months or longer on this medication. So my recommendation is to look at other treatment options, even if you are diagnosed with type 2 hypogonadism. I do not believe that Clomid monotherapy, which many physicians, including hormone clinics, are now prescribing all over the country, I do not believe that is a good solution. Feel free to drop me an email. You can reach me through my website, www.nextleveldietetics.com, if you have any questions, if you want to discuss further, or if you've been treated with Clomid and you find that your numbers have improved but you're still symptomatic, I'd be happy to speak to you about that as well. Again, pick up a copy of George's book. It is absolutely phenomenal, wealth of information, and let me know if you have any other questions. Thanks for watching.